what we will principally focus on is these young persons between the ages of 14, I would say, up to about 25. For those of you who practice in children law and practice in the Court of Protection, you will know that in fact this particular group, this particular age group, have their own vulnerabilities. 9 times out of 10, it can be because of their background, their circumstances, the trauma that they've suffered, but it can also, of course, be down to disabilities, limitations that they might have. And in fact, therefore, it's very important for practitioners who will work alongside these young adults and work with the professionals working alongside these young adults to understand the different complex overlapping legislation that provides for them, and also to understand the different jurisdictions and the courts that can be implored to meet their needs. But of course, we know that these years are crucial in terms of education for young adults. And in fact, a few points that I want to make about that is that an education and healthcare plan can be in place from the age of 14 onwards. That means that those young persons who may well have special educational needs and need some adjustments and support should be able to access that via a formal plan from the age of 14. And the focus of that plan should always be preparing them for adulthood. There is guidance in the SEND code, SEND code, to allow them to make sure that they reach their full potential. And if anyone wants to look at the plan and decide, is this plan meeting a child's needs, then the guidance is in the SEND code as to what it should be doing. So you will all know that as a result of Article 5, we have a right to our liberty and security, which can only be restricted through a procedure prescribed by law, and that is the issue of deprivation of liberty, or one of the ways that it can be prescribed by law is through deprivation of liberty. And in English mental capacity jurisprudence, someone is deprived of their liberty only if they lack capacity, they are subject to continuous supervision and control, they are not free to leave their placement, and the placement must also be imputable to the state. So what that means is the state needs to know about it. And just so you know, by case law, that's quite a low test in terms of what the state needs to know. This is known as the acid test, and it was established by the case of Cheshire West.